السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم. والصلاة والسلام على أصدق الأنبياء والمرسلين محمد صلى الله عليه وعلى آله وصحبه أجمعين. Thank you all for coming today. Just going through quick housekeeping instructions. We remind everybody we really appreciate it if you keep your mask on, covering your mouth and your nose. I know it is hard, but we have to do what we have to do. And we are almost at the halfway through. After Dr. Khalid Elzamzamy lecture, we'll break for the Dhuhr prayer, followed by lunch. And I'll remind you, lunch is at will. You're free to go to lunch, or you can stay here at the center afterwards. But there are several options in downtown Houston for you to choose from. And if I may also take one quick minute for those of you who wasn't here when we opened this series. We've been out again for 2 years. And really the pandemic has been an eye-opener in a great way, sometimes in a bad way. We've stayed away from our loved ones. We were forced to stay away from masajid. And honestly, the masajid took the biggest hit. As a nonprofit organization, this is our bread and butter, so to speak. People, you, yourself. And with that came a big cost. Some had an anxiety. We started having withdrawals, sadness, depression, lack of faith, or I would say lack of faith, but our faith has decreased somewhat. So alhamdulillah Rabbil Alameen, with this event we hope that we mark going back to the in-person program, but also the pandemic highlighted how important it is to have that personal touch, that human touch in our life. And that's one of the reasons we wanted to bring such a program, because it's relevant. It educates us about ourselves, which is the core of Islamic teaching, as Allah subhanahu wa ta'ala says in the Quran, وَنَفْسٍ وَمَا سَوَّاهَا يَعْلَمُ فُجُورَهَا وَتَقْوَاهَا. The nafs, Allah subhanahu wa ta'ala created us from that body, mind, and spirit. وَمَا سَوَّاهَا يَعْلَمُ فُجُورَهَا وَتَقْوَاهَا. Allah knows its piety, and Allah knows when it loses its way. So what do we do to regain that way? What does Islam teach us to regain that way? When we face calamity, when we face sickness, how do we recover? I believe this is what we're trying to do today with this great series of great professional scholars to teach us how we come back, how we find our way back. And that's the question, the main question we're trying to answer this weekend. With that, it is my honor to present our next presenter, Dr. Khalid Elzamzamy. He's a medical doctor. He's in psychiatry, fellow at the Institute of Living at Harvard Healthcare in Connecticut. He received his medical degree from Ain Shams University, Egypt, and completed his psychiatry residency and fellowship at Ahmad Medical Corporation in Dawah, Qatar. He also completed a master's degree in Islamic ethics at Hamad bin Khalifa University in Qatar. In addition to his clinical work, Dr. Elzamzamy is an active researcher and scholar. His interests include investigating the history and current practice of mental health in Arab, Muslim, and migrant communities. The interplay between the mental health, culture, spirituality, and religiosity, as well as a suicide prevention and care. He previously served as a research assistant at Yale University. He currently a research fellow at the Family and Youth Institute and is a faculty member in the Islamic Psychology program at Al-Karam Institute. Please help me welcome Dr. Khalid Elzamzamy.
السلام عليكم ورحمة الله. بسم الله الرحمن الرحيم. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. I'm just asking my brother here because I'm going to be moving a little bit. So if I move too much, just let me know and I can pause. Also, I was hoping to have a microphone for the audience. I'm going to be asking for a lot of interaction, and I hope that's okay with everyone. Just before I start, when I was listening to Dr. Carey, my Egyptian sense of humor was kicking in. When she said Al-Ghazali children's program, I thought Imam Al-Ghazali moved to Houston and is offering a program now here for children. All right, so our topic for today is Islamic psychology and mental health. So I'm going to start by just a quick quiz. Who said, "The eye weeps, the heart grieves, but we say only what our Lord is pleased with, and we are grieved by your loss"? Anyone from the back? I can't hear. Prophet Muhammad, and what was the occasion? The death of his son Ibrahim. So the Prophet ﷺ said, "العين تدمع والقلب يحزن ولا نقول إلا ما يرضي ربنا وإنا بفراقك يا إبراهيم لمحزونون." And I also, this takes us to this other quote here, who says, and this is from the Quran, إنما أشكو بثي وحزني إلى الله, and I complain of my anguish, my suffering, and my grief only to God. Who said this? From the back? Prophet Yaqub alayhi salam. And what was the occasion? So the loss of his son, Yusuf alayhi salam. Now these are two examples of profound moments of emotional distress that were experienced by some of the prophets, Prophet Muhammad sallallahu alayhi wasallam and Prophet Yaqub alayhi salam. And these are just a few of the moments of significant and profound emotional difficulties and struggles that some of the prophets have gone through. And the reason I wanted to start with this is that we are talking about Islamic psychology and mental health. So we are looking at two main domains here: Islam as a religion and mental health as a field, right? And when we look at Islam as a religion, we see that there are various domains of Islam, whether it's the Quran or the Hadith or the Islamic creed or the Islamic law, fiqh. We see multiple references and notions to emotions, to various levels of emotions and feelings. Sadness, the word huzn, which is the root word for sadness. Can someone just take a guess how many times the word sadness, huzn, and its derivatives, different roots of sadness have been mentioned in the Quran? Just take a guess. Anyone? Dr. Hassan? 40, almost 40, more than 40 times in the Quran, just the huzn or hazan, yahzanun, la tahzan, have been mentioned in the Quran. And that's just one emotion, right? Let alone ham and gham and worry and anxiety and grief and fear and so many other emotions. And that just on the emotional level. Now, the amount of references to interpersonal relationships in the Quran and the Sunnah is just tremendous, right? Relationship between parents and children, spouses, taking care of the elderly, and the impact of these relationships on mental health and mental well-being, and how the Prophet ﷺ would comment on a father who wouldn't kiss his children, for example, and says, "What can I do if Allah subhanahu wa ta'ala has taken mercy out of your heart that you don't kiss your children?" He said, the companion said, "I have 10 children and I've never kissed any of them." The Prophet said, "What can I do if Allah has taken the mercy out of your heart?" Right? When the Prophet ﷺ is giving premarital advice, when a lady came to the Prophet and said, "Two people proposed to me, which one should I marry?" And the Prophet did not comment on the religion of any of these two men. He commented on their akhlaq, their traits, their character. One of them had potential of domestic violence. So the Prophet said, he does not put the stick down, meaning that he hits women. So the Prophet ﷺ is giving psychological advice, is giving mental health advice to someone who is considering marriage here, right? If we look at how many references to behaviors in the Quran, references in the Sunnah and the Quran about well-being in general, about healing approaches. If we look at the Islamic view, the Islamic worldview, the Islamic creed, our aqidah, and again, how much that worldview gives so many of us a sense of comfort and understanding and a meaning. I was talking to someone earlier this morning, and they were telling me about a difficult situation they are going through. And the first thing they said when they were talking is, "Inna ma'al usri yusra." Right? So that every one of us here in this room has a scriptural reference, whether it's from the Quran or from the Hadith or from that tradition somewhere that helps us through difficult situations, right? And that Islamic worldview that the Prophet ﷺ, when he says, عَجَبًا لِأَمْرِ الْمُؤْمِنِ إِنَّ أَمْرَهُ كُلُّهُ لَهُ خَيْرٌ. Like the affair of the Muslim, of the believer, it's just ajib. It's surprising that everything that happens to the Muslim is just khair, right? And some of us would find this hadith, would resonate with this hadith when we're going through difficult situations. And I bet if I ask, and maybe if anyone here wants to share with us, is there an ayah, is there a hadith, is there a prophetic story, is there any situation that you remember from the seerah, from the Quran, from the hadith, that you remember when you're going through a difficult time? Maybe you can hear just 2 or 3. Just one ayah, one hadith, one Islamic reference that you use that gives you comfort in difficult times. Anyone feels comfortable sharing? Yes, please. Yes. ألا بذكر الله تطمئن القلوب. That indeed in the remembrance of Allah subhanahu wa ta'ala, hearts find tranquility, right? So, for example, if someone is going through a difficult time, they might remind themselves of this verse and then find remembering Allah subhanahu wa ta'ala, making dua, making dhikr, that it brings comfort to them, knowing that there's hope. Sorry, you raised your hand?
Actually, there was a colleague of mine who was Hindu, and when a coworker of his died during work that they were doing together, he said, I thought of, to God we belong, to him we return.
SubhanAllah. So the word that we use when someone passes away, inna lillahi wa inna ilayhi raji'un, that in itself is a very strong, again, these are, in psychology and mental health, we talk about automatic thoughts. And sometimes if our automatic thoughts are negative, they can take us to very negative emotions and feelings. So Islam equips us with so many automatic thoughts, right, that are just positive, that inspire hope and resilience and resistance. And that's one of them, right? When someone passes away, that's the most significant, one of the most significant events that anyone can go through, like we saw with Prophet Muhammad sallallahu alaihi wasallam. And then we remember that to Allah we belong, and to Allah is our return. It's just, this is our worldview, right? So our Islamic creed is kicking in here and giving us a window through which we can regulate our emotions and feelings, right? Yes, please. Yeah, so she said that she remembered, Inna lillahi wa inna ilayhi raji'un. To Allah we belong, and to Allah we return. Yeah? And finally, again, we are looking at different domains of the Islamic tradition here. And if you open any manual of Islamic fiqh or Islamic law, you won't find a single chapter in which mental competence, mental capacity is not referenced, right? That if you want to make wudu, you have to have mental capacity. If you want to pray, you have to have a mental ability, mental competence. If you want to give zakah, you have to have mental competence. So mental health is referenced in every single chapter of Islamic fiqh. You cannot make a contract of buying and selling if you don't have a mental capacity, mental competence, mental ability. Lots of references to that in all chapters of Islamic fiqh. And also, we see a strong impact of mental illnesses on what a person can and cannot do. There are lots of exemptions, rukhas, exemptions that people are given in the Islamic tradition because of a mental illness or mental difficulties and struggles and so on. Now, put all this rich tradition next to another very rich tradition, which is the mental health tradition. And we know that the mental health field is a very complex field, and that it intersects with so many fields. It intersects with medicine, with psychology, sociology, anthropology, philosophy, law, and so many other fields. So, mental health is the focus of our topic today, and its relationship to Islam. Now, just a very, very quick understanding of what mental health is, what mental illnesses are. And these are the different domains that when scholars are looking at mental illnesses, and I hope people in the back can see this, right? So we have here biological or neurobiological factors, we have psychological factors, we have social and cultural factors, and we have spiritual factors. And each of these levels affect our mental health, and a difficulty, a struggle, abnormality, a change, a distress in one of these levels can affect our mental health and mental well-being. For example, someone's genetics, if they have a family history of mental illnesses, can affect our mental health, can make us more prone to mental illnesses in the future. For example, if someone has a family member with schizophrenia or psychotic disorder, there's a 10% chance that another family member will have a psychotic disorder. If it was an identical twin, these chances are up to 50%. So 50%, if you have an identical twin who has a psychotic disorder, your chances of having a psychotic disorder are 50%. So these are real factors, and this is what Dr. Carey was referring to earlier, that it's not only spiritual factors that affect our mental health, it's not only social or psychological, but there are real neurological and biological factors that affect our mental health. Temperament, for example, is a biological phenomenon. You have two kids. From the moment they're born, they are very different, although they both have the same genes from the same father and the same mother, and that's temperament. One of them is very difficult to soothe. One of them is, when they started going to school, they had difficulty separating from mom and dad. These are all temperamental issues, right? And that these temperamental tendencies, a kid who is very shy, we call it behaviorally disinhibited. Kids who are very shy, who are disinhibited, have higher tendencies of developing anxiety disorder as adults. So these are all biological factors. There is no religious worldview, there is no akhlaq, there is no spirituality, nothing yet. We're just looking at biologically, how do these biological factors affect our mental health. Psychologically, the way someone thinks, our automatic thoughts that we talked about earlier, our thinking styles, right? Our developmental stage. Someone who's a teenager is in a very, very different developmental stage than someone who's an elderly, for example. And each of these stages in our lives, we go through very different struggles and difficulties. Social factors and cultural factors. If someone grew up in a household where they experience domestic violence, for example, or they've been maltreated, or experienced lots of fighting between parents as growing up. They moved from one house to another very, very frequently, lost relationships and friendships and so on. Someone who lost family support in a very young age. We've seen studies, and this is one of the most cited studies in the history of child psychiatry, is the ACEs study, ACE, and stands for Adverse Childhood Experiences. And they have seen that kids who have been experienced to ACEs, to adverse childhood experiences, primarily abuse and violence and neglect, their chances of developing mental and physical illnesses throughout their lifespan is much, much higher than anyone else. This is nothing that has to do with who they are they Muslims or non-Muslims, what their religious orientation is, what their worldview is. Just the fact that they have experienced childhood negative experiences such as abuse and neglect just automatically would put them at a much higher risk of developing mental and physical illnesses. You cannot imagine the number of mental and physical illnesses that they have been at higher risk for. Substance use and mental disorders. Even they notice that these kids would live shorter lives. The lifespan can be shorter because of these early experiences. All of this, we have not yet touched spirituality. Right? And this is where Islam comes in, and this is where the interaction between Islam and mental health comes in, and we're going to talk about this a little bit further. When you go to a psychiatrist, and I know many of us here feel resistant to see psychiatrists or psychologists, when you go to a psychiatrist or a psychologist, a clinical social worker, this is the Bible of psychiatry, the DSM, or the Diagnostic Manual. The Diagnostic Manual of Mental Disorders. And the reason I'm putting it up here so that I can just for us to reflect on the number of things that a psychiatrist or a psychologist or a counselor can help with, the number of mental disorders that are out there in the community, right? Because sometimes we feel like every one of us has some notion or understanding of a psychiatric disorder. What does that mean? What does it look like? When do I go to a psychiatrist if I have what? When do I see a psychologist if I have what? But the reason I want to put the index here of the DSM-5 is just to show you the number of things that psychiatrists, psychologists help people with. So the first one is neurodevelopmental disorders, and this includes autism, ADHD, intellectual disabilities, learning disorders. So this is the first chapter. Schizophrenia and psychotic disorders. This is the second chapter. So schizophrenia, we all heard about schizophrenia. There are lots of, mixed understandings of schizophrenia in the public. If anyone has any questions about that, we can address that later. bipolar and related disorder. So we hear about bipolar disorder, and many of us use the word bipolar in a very, very, relaxed way. My friend at school is bipolar. Why? Because in the morning they were happy, in the afternoon they are upset. They are bipolar. This is very different than what bipolar disorder is. The next is depressive disorder. Basically someone who has depression, and it's called major depression, which is not just feeling sad, feeling distressed, but it's actually major depression, and it has criteria. And each of these disorders has criteria. Like, I cannot say that someone has bipolar without going through number 1 on the checklist, number 2, number 3, number 4, number 5. We're not just out there just labeling people with diagnoses and giving them labels and so on, right? Anxiety disorders, and there are so many anxiety disorders out there. There's generalized anxiety, social anxiety, there are phobias, and other anxiety disorders. There's OCD, obsessive compulsive disorders, trauma and stressor-related disorders. These are like PTSD, acute stress reactions, and things of that nature. Dissociative disorders. These are, again, another domain that sometimes is vague and not very clear what dissociative disorders are. Actually, this is a good place to reflect on this. Many of the cases of, that maybe a faith healer would say this person is possessed by a jinn, for example, in a maybe a secular, in a secular context, would consider these dissociative phenomena or dissociative experiences, right? Somatic symptom, these are people who have physical symptoms that don't have a physical understanding, they don't have a physical cause to them, right? People who are very worried that they have a physical illness, but there isn't anything going on physically that doctors can treat. So there are different disorders under this. Feeding and eating disorders, we all heard about anorexia, bulimia, and there are other disorders that they are trying to understand. New disorders are emerging and being added to the feeding and eating disorders. And just an FYI, since the pandemic, the number of kids, adolescents and youth who are presenting to the hospitals with eating disorders have almost doubled, if not tripled. And one reason for that, people are hypothesizing still, is the exposure to social media, because we've been spending almost all our lives on social media since the pandemic, and that exposure to social media have triggered so many mental illnesses. They just announced 2 months ago a national mental health crisis amongst youth and adolescents, and eating disorders is at the top of the list for presentation to the emergency rooms and hospitals and clinics and so on. Sleep and wake disorders, these are very, very common. Insomnia and all kinds of insomnia and difficulties with sleeping and so on. Sexual dysfunctions, gender dysphoria, and then substance use, which is a very, very big item here in the DSM. Neurocognitive disorders, this is dementia, Alzheimer's, and other disorders. Personality disorders, antisocial, borderline personality disorders, and a few other personality disorders. Paraphilic disorders, and then there's a whole range of other mental disorders. Now, I've gone through this a little bit extensively, but the reason why I'm doing this is to tell everyone that there are so many reasons why someone might consider, talk to a psychiatrist or a psychologist or a counselor. And psychiatrists are not just there to give you medications and label you with names and diagnoses, but there's a whole process of what they can do and what they can help with, what they can include or exclude, what they can tell you you have and you don't have. So it's a whole field. It's been around for some time. Again, this is our effort to break the stigma and encourage people to seek help. Now, before I jump into Islam and mental health and that relationship, again, something to help us understand mental illnesses a little bit better. Now, most people are in the normal range. Normal range of what? Of emotions, thoughts, behaviors. Meaning all of us have a normal range of emotions. You have normal happiness, normal sadness. You have a day where you woke up not feeling very well, you're cranky, you're upset, something bad happens, you feel upset, you feel angry, and so on. So this is a normal range, right? Now, people can cross that range to be unwell. And this is when they are given labels by psychiatrists or counselors or psychologists. They are given a label of major depression, generalized anxiety, a sleeping disorder, anorexia. When does someone cross that line? When our emotions, our feelings, our thoughts cross that normal range and start getting in the way of doing things. In every single disorder in the DSM-5 that we just went through, there is a criteria that says that change, for example, the depressive symptoms, feelings of sadness, lacking energy, feeling fatigued, can't concentrate, can't focus, that these symptoms have to cause some dysfunction, some impairment in your life, that you can't go to work anymore, you can't focus at school anymore, you can't have a normal relationship anymore. So it affects your occupational life, your social life, your educational life, academic life, right? So you don't cross that line and become become labeled with a mental disorder unless the normal range of emotions and feelings has surpassed that level of normal range and has started to get in the way of you being able to go about your life normally, right? Now, there's another line that some mental illnesses can cross, and that is the line of reality, when a person or that mental illness can cause the person to lose touch with reality to an extent. And that happens in schizophrenia and other psychotic disorders, where the person starts believing things or believing in certain things that do not exist, hearing voices of things that do not exist, seeing things that do not exist, and the person becomes a little bit detached from reality. So that's another line. Most mental disorders stay within that realm of someone is in touch with reality, but their emotions are getting in the way, their feelings are getting in the way, their thoughts are getting in the way. But then there's that line of crossing that line of reality. And in the Islamic tradition, in the legal manuals, you will hear the word junoon, right? And the word junoon is the classical Arabic word that was used for people with severe mental disorders. And just the word junoon itself, the root will help you understand why is it called junoon. The root of the word from the letters Jim and Noon, Jannah, means for something to disappear, to hide, right? So the word Junoon was used to describe someone with a severe mental disorder because they thought that their mental faculties have kind of like disappeared, have the word junoon again is for something to hide, right? So their mental abilities are hiding. So their aql, their mental faculties are hiding, are not functioning at their full capacity, right? And some people might say the word junoon also comes from jinn. So maybe it was called junoon because it means that there's jinn possession here, right? So there are different variations of why it was called junoon, but the word junoon means that something is hidden. And a person with a severe mental disorder in the classical times, if they were called majnoon, because their aql, their mental abilities and faculties have become less apparent, less clear, right? I'm going to pause here for a second and maybe take a question or two before I move on. I know we talked about a lot. Yes, please. With anger. Well, anger in itself is something that people need help with, right? Now, people with anger can have very different range of things that they might be, they might develop. For example, kids who have difficulty regulating their emotions and feelings, there's something called conduct disorder. There's something called oppositional defiant disorder in the DSM-5. And these are situations where kids have difficulty controlling their temper. They have lots of outbursts. There's also a disorder called disruptive mood dysregulation disorder. These are all disorders where people at a younger age, youth and children who have difficulty controlling their temper, their emotions, their feelings, they have these anger outbursts, emotional outbursts, and they become very, very frequent. This is when they need some help, because they become very disruptive at home or at school. But also anger issues in young kids and young children can be an indication of an underlying ADHD. And ADHD is, what does ADHD stand for? ADHD. Attention Deficit Hyperactivity Disorder, right? Many kids who have underlying ADHD that is not treated well, they can appear as having anger issues, but the reality is that they're just impulsive because they have an underlying issues that has not been treated, right? And I don't see anyone who's hyperactive here, so I guess we are all good here. No one has untreated ADHD here. Yes, please.
Said about schizophrenia or whatever syndrome. Someone lose contact with reality. You see, all things are deja vus, or things you saw them in your mind. It happened after a day or two, whatever. What do you call this?
Deja vu.
Not deja vu. Not
Yeah.
deja
So you have a feeling that something will happen in the future?
I get this feeling, something is going to happen in the future, and it happened.
You're called a prophet. No, that's not a mental disorder. Having a feeling about something that will happen in the future and then it happens. That's a psychological phenomena. There are telepathy and there are other psychological phenomena that can, explain some of these things. Just maybe the sixth sense or the sorry. I was saying the sixth sense or premonition. Yep, thank you. Just some people have that. Allah subhanahu wa ta'ala has bestowed upon them that. I can't. The Arabic word is not coming. Anyway, so some people are gifted with this. Allah subhanahu wa ta'ala, reveals things to them that will happen. It can be in a dream, and dreams are very, very profound in that they can reveal things about the future if it qualifies as a true dream, as a ru'ya, right? And there are other psychological, spiritual phenomena that also can enable someone to anticipate something or get a sense of something. You can see someone and feel like this person is such and such, and your feeling is correct, right? I'm gonna take one last question or last comment, please. Any demarcation? Got it. Okay. So he's asking, is there a difference between, or a demarcation between minor depression and major depression? There isn't a mental disorder called minor depression. There is subclinical depression or minor depressive symptoms that do not reach the level of becoming major depression, right? And again, in the DSM-5, you have to have significant feelings of depression, sadness, feeling low for almost 2 weeks, almost all day, almost all the time for the last 2 weeks. And that has to be associated with feeling fatigued, losing appetite, increasing your weight, decreasing your weight, lacking sleep, having insomnia, difficulty with concentration, you don't have energy, you have death wishes, suicidal thoughts, you are feeling excessively guilty. So all these, when you see all this picture, someone who's becoming socially withdrawn as well. So when you see all of that, you start thinking about depression. Not only that, but that has made them difficult for them to go to school, go to work, interact with people. They're just keeping to themselves. So all this makes someone fit under major depression, right? And that's why it's very helpful to reach out to doctors, to psychologists, to counselors, because they can at least tell you that you have nothing, major going on, and what you're going through is a normal feeling, normal emotion, normal response to a situation in your life, right? It's also very important to know that many of these mental illnesses can be caused by physical problems. For example, if someone has his thyroid is not functioning well, has hypothyroidism, right? And this is a very common condition. Now, someone with hypothyroidism, his thyroid is not, or her thyroid is not functioning well, can present with a typical depressive picture. If you go to a psychiatrist, they will tell you have depression, and here's an antidepressant pill. But if they do a blood test, they will find out it's a thyroid. If they treat the thyroid, you're good. Anemia can cause depression. There are multiple hormonal changes in our bodies that can cause depression, and that's why it's good to get checked, right? Maybe your depression is caused by something physical. If we treat that physical thing, we can take care of the emotional and psychological symptom as well. I hope this is helpful so far. All right. So now putting all this together, we talked about the Islamic tradition, talked about mental health, talked about the complexity and the factors that contribute to mental health. So if you put these together, religion and mental health and that interaction, so many layers of influence can happen, so many layers of interaction between religion and mental health can emerge. And these are just 8 of these layers of interaction. Number 1 is religion can be a protective factor against mental illnesses. Our religion, Islam, or religion in general, affects our understanding of mental illnesses. Why does a mental illness happen? How do we cure mental illnesses? So our understanding, our conceptualization of mental illnesses. Some psychiatric illnesses present with religious symptoms, meaning, for example, in OCD, the symptom of OCD can be what? For example, repeating their wudu 10 times. Because they feel that the wudu is not complete. Now, OCD is a psychiatric disease, a psychiatric illness, mental illness, but the manifestation, the symptom of it is what? is religious in nature. If that makes sense? Someone who has psychosis and they're hearing the voice of God talking to them. If they believe in God, it can be God talking to them. If they believe in Jesus, it can be Jesus talking to them. Now, the frame of reference to God or Jesus in someone who's psychotic is a religious manifestation here, of a religious symptom. So the psychiatric illness is presenting with a symptom that is religious in nature. One time I had on the same ward, I had a person who believed they are Jesus and a person who believed he's Antichrist, right? So, and they were getting into arguments and fights and so on, right? So these are symptoms that have a religious connotation to them, right? And I'm not saying this to make fun of the symptom, I'm just saying that we've seen that, right? Help-seeking attitudes. Our religion can affect, if we seek help, the stigma that Dr. Carey was talking about. There are legal and fiqhi impacts of our mental illnesses. Religion, Islam, can affect treatment approaches. There are ethical dilemmas in clinical practice. For someone like myself, like Dr. Hassan, who are in clinical practice, sometimes we face ethical dilemmas because of our religious orientation, our religious understanding, our religious beliefs. And finally, some religious experiences can be sources of distress. And that might be difficult to understand for some people. But what I'm hoping to do in the next maybe 10 minutes or so is I'll have a few cases up here, and we don't have to go through all of them. But if we get a chance, we started at 11:30, so we are half time right now. We'll try to go through as much as possible with these cases, because I have a few more things to cover afterwards, inshallah. And I was hoping to ask some of you to help me with these cases. I wanted to make it real. I wanted to I wanted to make more sense to you guys. I wanted it to help you also understand mental health and mental illnesses. So that's why I'm using cases here. And I'm going to give you an example of what I want your help with, okay? For each of these cases, I'm hoping that someone will stand up and just volunteer to help me make a connection between this case and one of these 8 domains here. For example, we have Maryam, who is a 45-year-old woman who was diagnosed with cancer. She is seen by the hospital psychologist. When she's asked how she's been coping with her illness, she replied, "I know that everything is destined by Allah. I'm satisfied with whatever Allah destined. This illness has brought me closer to Allah, and I feel His presence more in my life now." So if I'm trying to understand this case here, the case of Maryam, and looking at how religion can affect our mental health, mental well-being, and I'm giving you an example here. So I feel like Maryam is showing us how religion, how our worldview, our relationship with Allah, can be protective against mental illnesses or emotional difficulties, emotional distress, because she's using her worldview to help her deal with the difficult emotions that are coming with cancer, right? All right. Here's the next case. Who would like to volunteer? I'm going to read the case, and then I want to volunteer, and we'll go through these quickly, inshallah. Omar is a 22-year-old who was referred to a psychiatrist due to psychotic symptoms for 2 years. He believes that intelligence agencies planted a chip in his head to track him. He also reported hearing the voice of God telling him to pray more. Over the last 2 years, his parents have taken him to 4 faith healers who have offered ruqya, recommended using a special oil and water to cure him from what they believe is the effect of black magic. The case can be connected to multiple of these layers. It doesn't have to be only one, and there's no wrong answer. So I want a volunteer. Yes, please. So treatment approaches, and where is that in the case? They took him to a faith healer instead of a psychiatrist or a psychologist or a doctor. What else? Any other layers? Conceptualization, where is that? Okay, so the symptom itself, like the psychotic symptom that they believe that there's an intelligence agency. So that is a delusion, right? That is the person believes that something happened. And we've had patients actually asking me to do X-rays and MRI scans because they feel like there's a chip in my arm. Can you do an X-ray an X-ray on my arm to see if there's a chip or not? So these are, again, real symptoms that people experience and can be very, very distressing, right? I've had people who refuse to give us blood work. They said, my blood is very precious and you're going to use it to make treatments for cancer, and I'm not going to give you my blood. I've had people who refuse to eat food for 3 or 4 days because they feel that the family members are poisoning the food, right? So just there are real symptoms, real experiences, and if anyone in our surroundings is experiencing something like this, we need to get them some help, right? Any other layers here of interaction? Yes, please. Treatment approaches, yep. They took him to a faith healer, yes. Religious symptoms, yes, because he's saying that God is speaking to him and telling him to pray more. And also, one of us said conceptualization of mental illnesses. So again, here, attributing the mental illness to black magic is a conceptualization of mental illness, right? You are seeing psychological symptoms, and you are understanding them as the effect of black magic or jinn possession or evil eye or and so on, right? Before I forget, I hope in order not to forget, Dr. Carey was talking about jinn possession, right? And Ibn Sina, in his book, he actually makes a very interesting reference. He says that even if the psychiatric symptom is due to jinn possession, we treat it the same way as we treat any psychiatric symptom. The example of this is someone fractures their arm. If the mom believes that her kid fractured their arm because of evil eye, will you make dua or take them to the doctor? That's what Ibn Sina is saying, right? He's saying that even if we see a psychiatric symptom, the treatment of it is we treat it as we know how to treat psychiatric symptoms, right? Even if it's caused by jinn possession or other things, right? I want to move on to the next case, if that's okay. Is that a question or a reflection on the case?
Would you also consider ethical dilemma also because we're caught between the traditional and
That's a very, very good point. Thank you. And we struggle with this a lot. When I was working in Qatar, we had so many patients coming in, and the parents want to take them to the faith healer, and I'm the psychiatrist. And can I tell them to go or not? Because I know that some faith healers outside don't have any, ethical, codes of conduct or ethical. They engage in some unethical practices. But there are also faith healers who do things very ethically and very professionally, right? So we have that conflict sometimes whether we recommend or not recommend. What to tell parents if they want to go to traditional healers, right? Thank you so much for this. This is a very good point. Now, some studies in Muslim communities have indicated that patients, families, and faith healers attributed mental and neurological illnesses to evil eye, jinn possession, and black magic. Mental illnesses that are frequently attributed to supernatural or spiritual causes. What do you think are the most common psychiatric illnesses that are attributed to jinn possession, evil eye, black magic? Which ones? What do you think? Schizophrenia, psychosis, anything else? Seizures are very, very frequently attributed to these as well. What else? OCD sometimes. Multiple personality, dissociative, yeah. So multiple personality falls under dissociative identity disorder. So dissociative disorders, perfect. You guys have studied all this before? All right. So psychosis, dissociation, conversion, and also you mentioned OCD is sometimes attributed to that as well. And another just comment here, persons, and this is just studies showing how many people actually seek psychological psychiatric help versus traditional healing. So persons with a condition that meets criteria for DSM were more likely to approach clergy than psychologists and psychiatrists combined in one of the studies. So people generally tend to go to faith healers rather than psychiatrists, psychologists. There's a study in the New York area amongst Muslims, and again, most congregants viewed the imam as someone who they would turn to for religious guidance and counseling. We're not saying not to go to the imam, not to go to Sheikh Amir, not to go to Dr. Hassan for religious counseling. We're just saying that there are situations where maybe a psychiatrist or a psychologist may be more equipped to support and help. And this is where we need to actually get the help we need. Now, this is a case here. Ali, a 23-year-old, presents to the mental health clinic with OCD symptoms. He has doubts about his wudu. He repeats his wudu multiple times and spends a long time in the bathroom before each salah to the degree of missing the salah. Secondarily, he experiences guilt feelings and feels very upset, but can't get rid of the doubts. His therapist utilizes Islamic cognitive approaches to correct some of his thoughts and invokes religious scriptures in therapy. Any takers? Where does this interact here with our chart? Yes? Sorry? In the back? Yeah. Religious symptoms, perfect. In the back as well, all the way to the back. Religious symptoms, yep. Anything else? Treatment approaches, perfect. So the therapist is integrating Islamic cognitive approaches to their therapy, so treatment approaches here as well. Yes? Source of distress. That's very good. Thank you so much. So here is a religious experience that is a source of distress. Right? The fact that they are missing salah because of their psychiatric symptoms, it's causing them so much guilt. So now, if they engage in this vicious cycle for a long time, I've seen people with OCD who actually end up quitting salah because it becomes a significant source of distress. Every time they want to pray, they have doubts about their intention, their wudu, they have to repeat that, they have to spend an hour in the bathroom. It becomes so difficult that they end up just leaving salah altogether, right? So thank you so much for highlighting this as well. some of the literature here, references. Main mental illnesses with religious symptoms or manifestations, and we mentioned some of that. Psychosis and OCD. Next. We are still with Ali. Again, a few comments here that I wanted to bring up for each of these cases. What do we have? Okay. The therapist here is integrating some spiritual approaches here in therapy, right? And some studies have indicated that many patients would love for the therapist or their doctor to integrate their religion into their treatment. This is a national poll in the US have shown that 48% of patients would want their physician, and that's not a psychiatrist, just their physician in general, to pray with them, right? A survey of 6 mental health centers found that 55% of clients would like to talk about religion and spirituality in therapy, right? So that's a very reasonable need for Muslims and non-Muslims, anyone who follows any religious tradition, that they want their therapist to respect, understand, and engage with the religious tradition, right? Next, Ahmad. I think I'm going to do one more case and then move on, inshallah. 23-year-old male with depression and suicidal thoughts in the context of, a relationship conflict. He was referred to the emergency room by his primary care doctor because of the suicidal thoughts. When he asked if he ever considered acting on these thoughts, he replies, "It's haram. I will never do that. I don't want to end up in the hellfire." Anyone? Yes? Protective factors. So he's invoking a religious belief here, a legal ruling here, as a protective factor against suicide, right? And research this is research over the last century, not just the last decade, the last few years, but systematic reviews of all the research that has been done over the last century has shown that religious involvement is related to greater well-being and happiness, greater hope, greater meaning and purpose in life, less depression, less anxiety, protective attitudes against suicide. So when we tell people, when people in general say, when someone comes and says, "I'm depressed," and we tell them, "Pray more," that connection is understandable. Like we understand why you would tell someone who is depressed to pray more. Because we know that prayers give hope, give connection, give meaning. So we understand that. But we have to also understand that religion is a very good protective factor. But when someone crosses, remember these lines that we talked about earlier, the normal range and then crossing the line to an unwell range. When someone crosses that line, sometimes it's difficult for religion to take them back up there. There might be other things that are needed to help them cross back that line to the normal range. Sometimes it's a medication, sometimes it's psychotherapy, and that psychotherapy can integrate their faith and their religion, right? But sometimes there's a little bit more than just pray more or read more Quran or do more dua to fix your anxiety problems or depression problems or treat your psychosis or your OCD, right? All right. Are these cases helpful? They are? Should we do some more? Okay, all right. I started 15 minutes late, so I have 15 extra minutes, right? No? Do we need to stop? Where's our organizers here? Sheikh Amir already left. All right. Are people okay with 15 more minutes? All right. Yes, please.
One thing that I've seen sometimes is that while it's protective in terms of not completing the act of suicide, it can be a source of distress because the patient thinks of suicidal thoughts as being like a sign
Unfaithful.
And that may prevent it as well, particularly because there's such a tradition of gratitude in Islam, practice of faith, and that they don't understand the biological phenomena.
Absolutely. What we are hearing here is that the fact that a person might be struggling with suicidal thoughts might itself be a source of distress because they feel like, how am I a good Muslim and I'm experiencing these thoughts, right? So here that religious experience can be a source of distress, right? Sarah, 24-year-old Muslim woman diagnosed with schizophrenia and is under treatment. Her parents are approaching the psychiatrist, who happens to be Muslim, to seek his opinion whether they can marry her to her cousin or not, and whether they have to let the cousin know about her condition. Where does religion come here with mental health? What's the interaction here in the back? Yes? So ethical dilemmas, how is that? Can you tell us a little bit more? So you are the treating psychiatrist, you shouldn't be giving maybe personal advice? Okay, so this is an ethical dilemma here, whether I should be involved or not. Perfect. What else? Yes.
Ego and impact because the legacy of being your bloodline, as you said, it's neurological. So like if she knows that she has this neurological thing, that can impact genetics into the next marriage.
So then the legal impact here is that the husband or the future spouse, the future husband, the future husband, future wife, they have the right to what? To know that there's a mental illness, right? And that's a legal requirement, right? And in the fiqh manuals, you would find discussions on if, for example, 2 years into the marriage, the person has a psychotic relapse, have psychotic symptoms, and they didn't know before getting married, they have a right to annul this marriage, right? So they talk about the husband's right or the wife's right to knowing things before marriage, right? So mental illnesses are very significant, like any other significant physical illnesses that have to be revealed to any future husband or future spouse. So again, this is a level of interaction between Islam and mental health, but in the legal realm. And there's a whole field called forensic psychiatry and forensic psychology that deals with that interface between mental health and law in general, right? Next, Hassan is a Muslim therapist working in private practice, not Dr. Hassan, but just another Hassan. He receives a new referral for a client who experiences depressive symptoms, which he attributes to his parents being unaccepting of his same-sex relationships. Hassan finds himself in an ethical dilemma, trying to reconcile his professional duties with his religious beliefs about the prohibition of same-sex behaviors. What layer of interaction here? Anyone? Yes? Religious symptoms. Where is that?
If he was not identifying as Muslim, the same-sex relationship might not cause him distress.
Okay. Can it be also like his religious experience is a source of distress as well? That he is struggling because of these inclinations, and that his religion says something, his parents identify with these religious thoughts and beliefs, and that's causing that distress, right? That religious experience is causing that distress. Any other layers of interaction here? Yes? Fiqhi and legal impacts. How is that? So there's a legal hukm, there's a legal ruling here that has to do with a certain manifestation, certain symptom or certain experience that this person is going through. And so there are legal impacts as well. How about anything else? Yes? Ethical dilemmas. And I think it says here, an ethical dilemma. Perfect. So a good catch. Yes, I wanted someone to say this. And that is experienced similarly, not only with same-sex experiences, but if someone, a Muslim doctor, and a person is asking for abortion, and the doctor, for example, believes that a woman shouldn't get an abortion if it's not medically indicated, then that can cause some similar experiences. If someone is treating a patient and they are drinking or using substances, or they're having extramarital relationships, similar conflicts can arise, similar value conflicts can arise in clinical context. Not only for Muslims, but from other religious traditions as well, can experience that. You can work with an atheist psychiatrist, and you present with some religious experiences, and they can have difficulty also, understanding these experiences and helping you through these experiences, right? Okay. I'm going to stop with the cases because we have some other content to hopefully go through. All right. There was a video that I wanted to watch together, but maybe we can, watch it another time, inshallah, or maybe you can take the name of it and look it up on YouTube. It's called Owning Our Legacy, Muslims and Mental Health by the Family and Youth Institute. And I helped in the development of this video. It just walks us through some of the things that we already discussed. And the reason I want you to watch this video is that it really talks about the relevance of talking about all of this. Why do we need to talk about mental health in the context of Islam? Because of the prevalence of so many mental illnesses in the Muslim community, right? Autism, 1% of all children are born with autism. Anxiety disorders exist in almost 20% of the population here in the US. Depression, almost 1 in each 4 adults would experience depression in their lifetime, for example. OCD is in 5 to 7% of the population, for example. These are very significant numbers, and we cannot just, as Muslims, just claim that we don't have mental illness in the society. I can guarantee you that every single person in this room has someone which is either a friend or a family member who struggles with some mental health issues. But we are good at just hiding it and keeping it to ourselves rather than reaching out for help and services. All right. So I wanted to, we went through some of that earlier, again, back to the earlier notions of mental health in the Islamic tradition, and Dr. Carey also referred to some of that in the past. And here are more. We talked about all of these before, but here's even another layer of the attunement to emotional and psychological experiences by the Prophet ﷺ. The Prophet ﷺ, in a hadith in Sahih Bukhari and Sahih Muslim, when a person is grieved by the loss of someone, when there's a death in a family, the Prophet ﷺ would say to offer that family a dish, a meal, that is called at-talbina. And at-talbina is like a porridge made of barley, right? And the Prophet ﷺ, look at the words that he uses. In Arabic, he says, at-talbina مجمة لفؤاد المريض وتذهب ببعض الحزن. He is describing an antidepressant. Like, this is how we describe antidepressants to patients. I say, take this pill, it does that to you. This is what the Prophet ﷺ is saying here. He's saying at talbina, it soothes the heart of the bereaved and it relieves some of the sadness. He's saying that this dish, this meal, has some antidepressant qualities, right? And it just tells you that the Prophet is understanding that there's a biological component to sadness and depression and grief and bereavement, right? He's saying, eat that, it helps your mood, right? It's like chocolate today. Whatever the question is, chocolate is the answer kind of thing, right? Right? Not only that, but the Prophet ﷺ has taught us certain du'as, and this is a du'a that I consider, like, this is a psychological manual right here, right? And this is a very famous du'a the Prophet used to say in the morning and in the evening, and he used to teach the companions, and in Arabic it goes, Allahumma inni a'udhu bika min al-hammi wal-hazan wal-ajzi wal-kasal wal-jubni والبخل وغلبة الدين وقهر الرجال. Psychological symptoms, psychological stress, psychological disorder, social stressors, everything is in this dua. Oh Allah, I seek refuge in you from worry and grief. These are the two most common psychiatric illnesses, depression and anxiety right here, right? From helplessness and laziness, from cowardice and miserliness, from being overburdened with debt. And that is one of the biggest social stressors in anyone's life, right? Being overburdened with debt, right? Or overpowered by men, by people, being in a situation where someone is harassing you, is accusing you of something, is holding something against you, and so on, right? And that dua, actually, the interesting thing is, in one of the narrations, the Prophet was saying this dua very, very frequently on his way to the battlefield, as if there's a notion here that the battlefield is associated with so much loss and difficulties and tragedies, so we need some psychological protection here from Allah subhanahu wa ta'ala, right? And that spiritual tradition, Islamic tradition in the scriptures and the aqidah and the worldview and the books of law inspired the whole tradition, a whole interest in Muslim scholars to investigate and understand, the human psyche, and Dr. Carey has referred to some of the historical aspects of mental illnesses and Islamic psychology. And this is a poster that I presented at the Muslim Mental Health Conference. Is the microphone working? Yeah. I presented at the Muslim Mental Health Conference in 2015. I brought a very small version of it here because I couldn't fit the bigger version in my suitcase for anyone to take a look at afterwards. That poster is available online as well. We can send a copy as a gift to the Dawah Center to maybe post in the library here or maybe in the exhibition here somewhere. So it's available here. It's available online. If you type my name and my academia page, you can find the poster. So it's basically, in that poster, what I tried to do is I gave some historical background of the development of psychological sciences in the tradition in general, and then some of the psychological theories and ideas proposed by Muslim scholars in the past, some of the psychological treatment practices, some of the earliest hospitals that were built in the world, not only in the Muslim world, in the world, where in the Muslim communities, some of the very unique approaches to therapy, classifications of diseases, the mind-body connection of how our minds affect our bodies and our bodies affect our minds, to just a very, very rich Islamic tradition of psychology and mental health. And it just was, as one of the recent scholars who talked about the history of mental health, they said, and I'm going to put it here up the side, sorry, these are just, okay. They said, what we need is not just championing the historical contributions of Muslims, but actually trying our best to, investigate, but trying more sophisticated investigations to the practical applications of those writings. So we have a lot of work out there that is championing the Muslims' contributions to mental health. Now it's the time for the new generation to start examining all this tradition and actually trying to find applications to that. And the good news is that there are so many works that are being done right now to take that step forward of developing a psychiatric practice, a mental health practice, that is very sensitive to the needs of the Muslims. And this is a paper that was published in 2020 that reviewed the last 10 years of studies and papers on Islamically integrated psychotherapy. They found 37 articles, 6 books between the years 2005 and 2015, only in these 2 American databases. So imagine if they expanded that search into the databases of Turkey and Malaysia and Indonesia and Egypt and Turkey and Iran and so on, right? And this paper has covered different themes of the literature out there. So all these are the lists of papers and literature out there on the integration between Islam and mental health and psychology, published between 2005 and 2015. And they talked about how this is an emerging, it's a development process, as Dr. Carey said. It's a steadily emerging literature. We need more theoretical formulations. We need more therapeutic tools developed for Muslims. We need more empirical research to examine these strategies and tools. And some of the limitations, as I said, is that they only looked at Western databases. Again, the good news is that there are lots of works that are being published in the last few years, 2 years only. We had the book by Rothman, by Dr. Kishavarzi, by Dr. Carey is here. We have this book by Dr. Rasul. There's an upcoming book next year called Clinical Applications of Islamic Psychology by Dr. Haq and Dr. Rothman. And Dr. Carey has proposed this model for extensive examinations of the Islamic tradition and the psychological field, and proposed that model of how to examine that. And I'm happy to say that in my thesis, master's thesis on suicide, I tried to apply that model. I looked at Islam, the tafsir literature, the hadith literature, the fiqh literature, the adab literature, the historical literature, the theological literature, to examine suicidal thoughts and behaviors, what causes them, how can we prevent them, what do we do in the case of suicide in the Muslim community. And I also integrated clinical psychology, social psychology, suicidology, mental health, psychology of religion and spirituality. So I was inspired by Dr. Carey's framework, and I tried to frame my master's thesis along these lines. And there are other efforts that are trying to do that. Dr. Rania Awad and her Stanford Lab of Muslim Mental Health and Islamic Psychology has published the Muslim Community Suicide Response Manual. There's this study that was published a year ago looking at depression, al-iktiab, between Quranic mufassirin, tafsir, Quran commentary scholars, and psychologists trying to look at the Quran and all the references to depression and so on, and compare it to psychological notions of depression. Khalil Center, Dr. Human Kishavarzi, and myself, I'm one of the co-authors here. We are publishing this book soon, Overcoming OCD, but the religious type of OCD. The religious type of OCD is called scrupulosity sometimes. So we are trying to publish a treatment manual for OCD that is religious in nature, and that's a lecture by Dr. Human that you can find on YouTube to treat OCD. I'm wrapping up in conclusion, and then I'm going to take your question. In conclusion, in this lecture, we looked at mental health. We looked at the Islamic tradition. We looked at the multiple layers of interaction between Islam and mental health. We looked at some of the historical contributions of Muslims, and we looked at some of the emerging literature in the field. And I'm going to stop here. And I apologize that this went a little bit longer. We wanted to leave some more time for questions and answers, but we can do that at 4 o'clock in the panel. So thank you so much, and thank you for carrying this legacy forward. Thank you.